Good news.
Today we will talk about the three most threatening diseases. First, we will go to Sylvia, who will explain us all this information.
Good morning, Adam. Well, the three most dangerous diseases are the cancer, the Ebola, and the HIV. Well, the cancer is a disease provoked by a group of cells that multiply without control and in autonomous way, invading locally and distantly other organs. In general, it tends to take to the death if the person does not treat himself adequately. There are no more than 200 different types of cancer. The most common are of skin, lung, breast, and colorectal. The Ebola is a critical illness and often mortally caused by a virus. The Ebola is a critical illness and often mortally caused by a virus. If the person with the disease of the Ebola must receive treatment in a hospital. Notice. The Ebola is a critical illness and often mortally caused by a virus. The person with the disease of the Ebola must receive treatment in an hospital. The survival depends on how answered the immune system of a person to the virus. A person also can have higher probability of surviving if he receives good medical attention. The persons who survive the disease of the Ebola are immunity to the virus for 10 years or more, and already they cannot spread it. The virus of human immunodeficiency, the HIV, is a virus that causes the AIDS. When a person becomes infected with HIV, the virus attacks and debilitates the immune system. If this weakness, the person is in risk of contracting infections and cancers, that can be mortal. When this happens, the disease causes AIDS. As soon as a person has a virus, remains this one inside the body all the life. The sharp infection for HIV progresses for some weeks until months and turn into an infection for HIV without symptoms. This stage can be last 10 years or more. During this period, the person might have no reason to suspect that he carries the virus, but it can transmit to the other person. Well, now we will interview some people.
Okay, I am Gerardo. So the topic here is cancer, and I think that this is a tremendous disease. As everyone knows, is I don't know. I think that the people that has that is unfortunate. I think, and well, I don't know. I mean, I think it's kind of sad that there's still no. I say that there's no cure for that, and that's kind of an awful thing. But I don't know. I mean, that's one of the. I think that's one of the worst disease in the world, and yeah, ya no sé qué más decir. Ayuda.
Because you can't cure it and...
¿No le puedo poner pausa a eso?
No, sí.
Se corta después, digo.
Sí.
Okay.
You can't cure it and...
Estamos pensando.
Sí. Di un caso, el que quieras. El caso de un caso. Invéntalo.
Okay. Well, Uh, no. There is a case that one of my uncles has it, but they detect the disease lately and no late, and well, unfortunately he died. But it was well, I don't know. I mean, I think that it was as the I don't know the same one. I mean, I don't know. I think that it was in the stomach. I don't remember. But the point is that well, he tried to cure for something like that with all the issues with I don't know. The point is that
And now we will go with the specialist Leo to know how to prevent these diseases and the treatment for each one.
Good morning. Today, the three most important and dangerous diseases in the world are the cancer, the Ebola, and the HIV. And first, I would like to talk about cancer. There are many types of cancer treatments, and the treatment you need depends on the type of cancer you have and how advanced it is. Some people only need one kind of treatment because of its type of cancer, or maybe because it was detected at a very good time. However, most of the people receive a combination of different kinds of treatments, such as surgery with chemotherapy or radiation. You may also receive immunotherapy, targeted therapy, or hormone therapy. There are many types of cancer treatment, and the treatment you will need depends on the type of cancer you have and how advanced it is. For example, some people only need one kind of treatment because of its type of cancer, or maybe because it was detected at a very good time. However, most of the people receive a combination of different treatments, such as surgery with chemotherapy or radiation. You may also receive immunotherapy, targeted therapy, or hormone therapy. Clinical trials may also be an option for you. Clinical studies are research studies with people, and knowing what clinical studies are and how they work can help you decide if you want to participate on it. When you need cancer treatment, there are many things you have to take into account and to learn. It is normal to feel confusion and impotence. But talking to your doctor and learning everything you can about your treatment options, including clinical trials, can help you make a very good decision. In the most common treatments, there are the surgery, in which the surgeon extracts the cancer from your body, the radiotherapy, that uses high doses of radiation to kill cancer cells and reduce tumors, the chemotherapy, that uses drugs to kill cancer cells, and the immunotherapy, that helps the immune system to fight cancer. The cancer have secondary effects: the anemia, poor appetite, bleeding, breathing, constipation, infections, and hair loss. Now, to prevent cancer, you only have to do 3 simple things. First, eat healthy. As simple as that. Second, do exercise constantly. And third, sleep well. If you cover these 3 things, you have already beat cancer. Now, the Ebola. The Ebola that doesn't have a known cure. However, it can be treated. For example, for the fever, you can administer acetaminophen, and it is very important to never take aspirin because of the bleeding manifestations. You should also drink plenty of liquids to avoid dehydration and also to rest in bed. The Ebola doesn't have a known cure, but it can be treated. For example, for fever, you can administer acetaminophen, and it is very important to never take aspirin because of the risk of bleeding manifestations. You should also drink plenty of liquids to avoid dehydration and also rest in bed. If the patient has hemorrhagic manifestations, it will require the intravenous administration of liquids, as well as platelet concentrate, coagulation factors, or blood transfusions if there are significant losses. It is necessary to keep a strict control of vital signs such as heart rate, pulse, and blood pressure in order to prevent any sign of shock. Now, to prevent the Ebola, reduce contact with wild animals that may be infected like apes, monkeys, and some type of bats. Avoid consuming of raw meat and use gloves and protective clothing to handle animals.
Last week, Ebola disease in West Africa has been underestimated and more mobilization is needed to fight this disease. The increase in incidence shows that response to the Ebola virus still faces significant challenges. Also, some civilians continue with practices that increase the chances of contagion. Staff in affected areas have collected evidence showing that the number of reported cases and the number of deaths greatly underestimate the magnitude of the problem. Our balance indicates that the Ebola epidemic in West Africa has left 8,981 deaths, while the number is infected rose to 22,495 between people confirmed and suspect to have the virus. We coordinated a massive increase in international response with individual support from various countries, disease control agencies, and UN agencies. We also indicated that the U.S. Centers of Disease Control and Prevention will equip affected countries with computers in order to have a real-time view of the evolution of the disease. The epidemic can last for some time. Our operational response plan will be implemented over the coming months. Given the existing situation, the health agency this week decided to approve the use of experimental drugs and vaccines to combat the disease. CITMAP, a test serum, is one of the authorized products which will shortly be applied to two Liberian doctors. The drug has used with good results in 2 Americans infected with the virus, although it didn't prevent the death of a Spanish priest. However, we warned that a series of ethical criteria, such as transparency about the nature of the drug, informed consent, freedom of choice, confidential respect for the person, prevention of dignity, and communication involvement, were necessary to apply the medicine. Specialists highlight the most importance of maintaining these classic public health measures, such as rapid infection of cases, isolation of patients, and the tracking of people who had contact with him, as well as a traditional measure for the control of infections.
There is no cure for the HIV, and the treatments can't remove the 100% of the virus of your body. However, they help to keep the CD4 counts high and improve the quality of life of the patients. There is no cure for HIV, and the treatments can't remove the 100% of the virus from your body. However, it helps to keep the CD4 counts high and improve the quality of life of the patients. The antiretroviral therapy is widely used. It is a combination of several antiretroviral drugs, whose purpose is to prevent the multiplication of the virus. It reduces the number of HIV particles in the blood and allows the CD4 count to remain high, which leads to improvement and prolong the life of the patient. Although, it must be kept in mind that the patient can continue to transmit the virus. And the secondary effects are headache, weakness, malaise, and accumulation of fat in the back and in the front. And when it is used for a prolonged time, it increases the risk of having a heart attack.
Thank you, Leo, for sharing with us this information.
Hi, my name is Jian. 2 years ago, I was diagnosed with gastric cancer, no carcinoma. In the wake of my own experience, I began to research on the best treatments, and I want to share them with all those who suffer some type of cancer. It was the hardest month of my life. When I was informed about my illness, I didn't even know how to react. I said, "Why me? Why? You never think that it will touch you. That is a disease that only you see in the documentaries or the news." In my case, according to the diagnosis, was an advanced case and possible metastasis in liver. I thought I was always careful. In fact, I don't smoke or drink alcohol. But in the way of my illness, I discovered several aspects of my daily life and habits that didn't take into account and caused my illnesses. Some of them because of the food, as not having eating habits healthy. You know, skip breakfast, not eat at your hours, start the day with a coffee, not adequately balancing your food, but especially by stress. Yes, you listen well. You know that when our body is under a constant level of stress, our organism secretes a hormone called adrenaline. This helps to cope and to get out of this situation of distress. But if your organism is frequently urinated, the cells are exposed to adrenaline to the point that they undergo a change or mutation to adapt and generate a tumor. My treatment includes several sessions of chemotherapy. The first, I got well, but the rest were for me an ordeal. After every treatment, I feel weak, poor appetite. However, finished the first treatment. But later on, when they repeat the test, confirmed to me that the tumor didn't stop and that had become resistant to chemotherapy. Practically, I was going to give chemo to not have me without treatment. I was then when a friend told me about a treatment that had been developed by researchers of National Polytechnic Institute, based on stem cells. That's when my family and I are looking for reference on this treatment, which is based on injection of stem cells into your body to strengthen your immune system, and in this way look for your own organisms to fight these abnormal cells. In addition to a strict diet of raw fruits and vegetables, but especially trying to reduce stress, which was difficult because of the same disease situation you suffer. However, thanks to this treatment combined with chemotherapy, I was gradually recovering health and overcome this terrible disease. This year, I did the last studies, and cancer has not returned. Today, I lead a healthier life and above all quieter.
Well, now you know what are these diseases and how to prevent them.